I'm going to rapid fire tell you the things that happen immediately after your baby is born and the decisions that we make. Are you ready? If your baby comes out immediately screaming, we are going to place them, amniotic fluid, blood, vernix, everything directly onto your chest. It is messy, but it is beautiful. 2, if they do not come out screaming vigorously, then we might do some stimulation, in which case we'll take a towel and we'll clean up some of that goop and see if we can get them to cry, see if we can get them to perk up a little bit. I might use that turkey bulb thing to suction out a tiny bit of the mucus from their mouth, and then we will place them skin to skin. If we are really concerned about your baby, then what we will do is we will probably not do delayed cord clamping, or we will wait as long as we can while we're stimulating, which is usually about a minute, and then we will take your baby to the warmer for some respiratory support if needed. It is really, really common that babies need a little bit of support, and often it's just a few minutes before we bring them back to you for skin to skin. Once we have determined the actual physical location that baby is going, then we will clamp and cut the cord. We will do delayed cord clamping if that is what you would like. And then I always offer it to mom first, because honestly, she's the one that did all the hard work. I've not yet had a mom take me up on the offer, and so then I will let dad cut the cord. Now, once the cord is cut, you and your partner are just going to be blissfully in your own world with your baby while I am hanging out down below doing the rest of the work. Now, you obviously know that the placenta needs to be delivered, but it can be normal for it to take 30 minutes for the placenta to deliver. So I might just be hanging out awkwardly down there while you are still very much exposed, but blissfully unaware. Once the placenta is delivered, then I'm going to check to make sure that the placenta is intact. If there is more bleeding than I want there to be, there is a very good chance that I will stick some or all of my hand all the way up to my elbow back into your uterus to make sure that there are no clots or placenta still in there making you bleed. This doesn't happen a lot, but it also doesn't not happen. Now, once the placenta is out and the bleeding is well controlled, then I am going to probably put in some freezing, regardless of whether or not you have an epidural, and stitch up the tear that you most likely have. And this is my big number 1 rule: nobody leaves my labor and delivery room unless their vagina is perfect.